Hi, good morning. This is Andrew Lowsutea, President. Hi, thank you very much for joining me. Especially, I saw a lot of people from all over the world, including people from Canada, Hawaii, Australia, and North America area. So it's really good to you can actually come to join our webinar. This webinar is very important because this is recognizing early sign of symptom of type 2 diabetic. Now, a lot of people say, why do you want to say this? Because I found we have a lot of clients now come back to me. Oh, wow, I'm pre-diabetic. What would be the early sign? Many of them have no sign and symptom. And I say, yes, that's correct, because we're pre-diabetic. Or even sometimes they have type 2 diabetic, but the early sign type 2 diabetic, and they don't have much symptom either. So the doctor just said that I'm type 2 diabetic now, but certainly their A1C is being 7 and 8 area. So they just started off the diabetic journey. But on the other hand, to be honest, sign and symptoms very limited. So a lot of people come back and say, hey, Andrew, can you tell us what is really will be involved? What is my journey is going to be? And then hopefully with that, I know all the early signs to watch for. That's why I created this webinar to help everybody, even though you are diabetic or you are already pre-diabetic, will give you some insight what to look for. Now, certainly you might say, well, would it be really have always a no sign symptom? Yes, in early days on type 2 diabetic, you might have no sign and symptom at all. Everything seems to be good. But in the 3 to 5 years later, things are going to come out. And those are going to be the problem that you have. And once you get that problem, things will get worse and worse and worse and worse. So that's why I thought perhaps with what we're trying to do is alert you to look for those signs and symptoms, and at the same time, start setting your lifestyle changes and differences so you can able to protect yourself. And that's what this lecture is all about. I think this is going to be a wonderful lecture for helping you to better understand what will be sort of the diabetic issues that you will face if you are diabetic. And with that, you can definitely able to see yourself to be, if I have that, this is the problem I will have. And you can able to start taking action to do that. So let me share the screen, and then you can able to start looking at the lecture. So I want to check that. Adriana, do you see the basically, do you see the webinar? Can you give me a 1 if you can? And that way we know that you actually see our webinar and hear us very loud and clear. That would be wonderful. And I know people from Facebook, many of them you also see it too. So give me a like, and so that way I know you are listening through Facebook. So give me a heart or something, whatever you do. So I know you give me a like, that I know you are there. Okay. So today our lecture will be recognizing early warning signs and symptoms of type 2 diabetic. Okay. Now, actually, it's very simple. Today's lecture is so good. You know why? Because one, we'll give you understanding what is type 2 diabetes. Second, we'll show you all the early sign of symptom and some of the risk factor when you are become a diabetic, and how do you get it there, and important early detection intervention. Like, more important, I hope that you can understand the intervention so you can start protecting yourself and don't get into the series of the diabetes that you might experience. So I want to make sure you have a lot of intervention, get your strategy and managing your blood sugar and all that. So we're going to teach you how to do that and how should they help you. And at the end, we have conclusion, question, and answer. So basically, today is a really good webinar to help you to get a foundation understanding what is a diabetic, type 2 diabetic, and what kind of sign symptom you might have, and what you can do to prevent this problem coming up. Okay, so now everybody have I know a lot of people are new here, so I want to make sure get this information out so everyone can still remember and catch up. Most likely everybody go through the 4 stage of diabetes. The first stage is LDL cholesterol goes up, and what happened is when it goes up, it damages the B cells, that come the pancreas is come up with this B cell. The B cells will take the sugar into the cells, and B cells damage, more and more B cells come out. It doesn't work, and more sugar are circulating in the bloodstream. So the problems start forming because what happened is the LDL cholesterol sugar mix together, the blood becomes thick, and quickly you move to stage 2. Because when you get stage 2, blood becomes thick, they form plaques everywhere, meaning these plaques will form the brain, heart, kidney, everywhere. So net result of that, this is the major problem of diabetes, because diabetes is plaques forms everywhere. And net result, it clog all the vessels, and eventually you're going to start forming with all type of health complications. And that is the key. But on the other hand, in the early stage, just blood pressure coming up. Now, then very quickly, if you don't do anything, because you have no incentive to do much thing, because you don't really feel much except slight blood pressure goes up, and maybe even don't catch it by the doctors. And you catch it by the doctor, they will give you some medication to start off. And then you probably move to very quickly going to what's called early diabetic. It's called pre-diabetics. Early diabetic is kind of before you become diabetic. Then pre-diabetic is every doctor measure the same thing called HbA1c. Now, HbA1c, they measure how much percentage of sugar attached to hemoglobin. And when you got hemoglobin attached, they say, you're 5.7, so you're still a normal person. But between 5.7 to 6.4, now you become what they call a pre-diabetic. Now, when you're pre-diabetic stage, is very important. You're really starting the journey of before you diabetes. You can actually reverse all that. So what you're going to do is you're going to do your lifestyle change, and then exercise, diet control, and weight change. All that will actually can help you to maintain that stage, or below 5.7, you become a normal person. Now, this is a stage you really got to work. But the sad part is you have no medication at that time. So you got to, maybe Lowsutea can really help you, plus your lifestyle change. So we have a lot of this group of people actually really do their work. You know what? They never go to diabetic. They will still stay in pre-diabetic stage or below, become a normal person. So really, this is the part that pre-diabetic is a key area that you need to work on. Then if you don't do anything, you say, nothing happened, and da-da-da. And then you move to stage 4, which is the diabetic stage. Usually this conversion takes only 2 to 3 years. And once your A1C over 6.4, now you are diabetic. So keep that in mind. That's why I want to keep repeating this. You can able to all understand, catch up with everybody. Now, why would I ask you to drink Lowsutea? Because Lowsutea has 2 things in there. One, they have guava leaves, which help you delay and absorb sugar entering the blood vessels. So that way, that less sugar go inside blood vessel. So even the sugar going in the blood vessel, no problem, because you have bitter melon. Now, bitter melon basically increase the insulin sensitivity, takes sugar into the cells. Also, it takes the cholesterol and sodium dump out to the urine. And that result, you lower blood sugar, lower cholesterol, lower blood pressure, because salt go out, blood pressure goes out, you will detox. And that's how Lowsutea works. It's 100% natural. There's no caffeine. You're drinking just like anytime tea, and no contradiction with any drugs. Now, we do not just ask you to drink Lowsutea, because you really got to change your lifestyle in order to work. Change your lifestyle, drink Lowsutea, low carb diet, and also low fat diet. That is one of the first things. Diet is very important. Now, second, even more important, is really exercise. And how would you exercise? Very simple. Just walk. 8,000 steps a day, you can do it. And once you get 8,000 steps a day, you're achieving this kind of goal. And certainly you can move on all the way down every day. Eventually get 10,000 steps, even better. And the third one is your weight control. Now, if your BMI is high, which is like 30 BMI, you can start lowering down to what? 23. This is your target. So you have lower weight. Now, if you lower 10% your weight, forget about BMI for now, just say 10% of your weight. You can actually minus 1 point of A1C. In other words, if your A1C is already 8, you go down 7. If you're 7, you go down 6. So even that is already help you to make it you from diabetic state to a pre-diabetic stage. Certainly you can listen to our regular professional webinar, include doctor and nurse, and myself, an ICU nurse. The reason why I give you this webinar is not to just give you diet understanding, but we want to give you the part behind why the disease process is like that. If you understand it better, then you make a better choice. When you get a better choice, you know the intervention, you know how to work with to prevent you to get serious complication. That's what we're trying to do. That's the reason why we have this lecture for all of you. And we have thousands of people actually can see this. Matter of fact, with one of the lecture, 15,000 people to listen. So this is why this is very important. Now, certainly you have to, in order to look at your blood sugar, you have to have daily blood tracking. You got to get daily tracking in order to understand. So your way to train is. Now, my objective here is, even though as high your A1C of 10%, we're bring it down to 5.7. But you have to follow these 5 lifestyle changes to help you and drink Lowsutea. If you do that, you will have a very good chance of success to get yourself into the A1C 5.7. I saw it with my own eye. A lot of customer actually brought their even long-term long-term diabetes. They brought themselves back to 5.7 or at least under 6. So this is a real challenge, but you can do it. It's up to you to act. So now let's understand what is type 2 diabetes. Now, type 2 diabetes is basically the body come up insulin, but not enough. The reason is because either you're getting more and more insulin resistant because, as I said, the cholesterol damage the B cell kind of insulin doesn't take the sugar in the cells. Net result, your insulin keep getting less and less and less, get more resistance. Now, typical diabetes, 95% of that is called type 2 diabetes. Now, type 1 is basically when you're young, you basically just don't produce insulin. But type 2 diabetes is 95% of diabetes is type 2, okay? And basically, it's really come down with, you know, your body weight, age, and you don't move. And as you time, especially age, you really have more chances of type 2 diabetic. Plus, you have family, and later we'll talk more about why you become a type 2 diabetic. Now, certainly, the sad part is the type 2 diabetic and type 1 probably about similar symptom because there are no symptom, basically. Until you have conditions that moving into more complicated, your problem will start develop. Then you say, I have some issue. Then you see doctor, you say, oh, I'm diabetic already. Oh, wow. Okay. So really at the end of the day, you are basically a lot of time in diabetes, type 1 or type 2, or even pre-diabetic, you have no symptom. And end up, a lot of people just don't understand until suddenly they went check. You're now diabetic. Your A1C is over 6.4. It's going to 7.8 already. Now, in the world, there are 422 million people globally is in diabetes. 95% of these people are type 2 diabetes. And about 1.5 million that will cause death and happen, many of them before age 70. And many of them have kidney disease. 460,000 have kidney disease death were caused by diabetes. And that's really sad because now in Hong Kong, 75% of the dialysis patients are because diabetic. And many of them, because of diabetes, they got blindness, heart disease, stroke, and they've amputated his leg and also kidney disease. As I said, mentioned in Hong Kong, 75% of the dialysis patients are diabetic. And you also have, basically the mortality rate are continue going up. And it's about 3% from between year 2000 and 2019. And cardiovascular death also related to high blood sugar level, and also because of that, they go to high blood pressure, 20%. Diabetic, actually, the growth is tremendously fast because of people age. Besides that, the diet issue, the lifestyle issue. So basically, this is even worse than COVID-19. But the sad part is, early sign of diabetic, you have no symptom, but you have a tremendous long-term issue in the sense of health. That's why I want you guys all working together to ensure you take care of yourself and change your lifestyle and not get into the boat, okay? So now, a lot of time when you're diabetic, you are usually, you might not know, but if you start finding diabetic, they also have problems. If you're pregnancy, you have diabetes, you have a higher chances become, your birth of a child will have some kind of birth defects. And these birth defects could be heart, blood vessels, kidney, urinary tract, gastrointestinal tract, brain, and spine. So you really do not want to get yourself serious diabetic if you're pregnant, or you don't want to get yourself, really at the end of the day, try to really make your diabetes well controlled when you're pregnancy. So that will be the best thing you to do. And it is very important. Now, also another thing, in type 2 diabetic, a lot of people have become depressed. The reason why is, wow, I'm really scared because, wow, I have to take care of myself. My blood sugars continue high. My eating will be all screwed up. There's certain things I cannot eat. So all that comes out with all diabetic distress. And this is including a lot of people feel, why me? They're so angry. And then also a lot of people just worry about the disease. Oh shit, today my blood sugar is 8 point something already. It's going up to 10. What is going to happen? And then I found that also a lot of people lack of motivation to manage the diabetes. Even though Lowsutea is very easy to use, but they feel, wow, I have to drink teas every day. Oh no, I don't want to do that. Or I want to get as little as things I do as possible. And really, actually, even slightly things they need to do, they lack of that motivation. And you really need to help them to break through that. They need to talk to someone, talk to me a lot of time. So I help them understand what happened and just do one step by step, called baby step, meaning that I drink maybe just 2 cups of tea or 3 cups of tea a day, eventually move up to 6 cups, and then they start seeing some result. Every time they measure blood sugar, they got more better and better, and they say, wow, okay, I get moving toward to the goal. So really, at the end of the day, you need to have a lot of motivation to help these people. Plus, they actually don't like to see doctor. You know why? Because they say, oh, doctor tell me today my A1C is 10. They're scared, and it's okay. Just know the facts will help you to bring it down. So they really do not want to check the blood sugar sometimes because they worry the number is high. And on top of that, a lot of people are lonely, especially elderly people feel really lonely to fight this disease. So first of all, they don't understand. Second, they said, I just know I cannot eat this, cannot eat that. They felt very frustrated. So in the diabetic distress, people need to check with people, talk to the nurse, talk to the children to at least open it up for them, hold their hand. That's the reason my lecture said will hold your hand throughout this diabetic journey to help you out, help you understand. Isn't that great? And that's why we'll do. Now, another thing will be kind of sad. If you have diabetes, your cost of healthcare will go up tremendously. In US, it costs you about $16,752. Now, this is what US figures. In Hong Kong, it will cost 100,000 Hong Kong per year, which is slightly lower, but very close to this anyway, US dollars. And so you really, if you are not diabetes, your healthcare cost is less, but you're diabetic, you 2.3%, 2.3 times more of this healthcare cost. Now, also, this including you might go to a hospital, inpatient care, prescribed medication. You have to have medication because you're diabetes. So you got every day, you got to take metformin, your diabetic supply, like the needle stick, doctor visit. Now, also because you have to go to all these things, you might start losing a job, lose your productivities. All that thing will, all that driving costs. And that's really sad. So really, I don't want you to really move into that, but maybe perhaps we can give you early warning signs, symptoms, so you never get into serious diabetic, so you can able to get yourself this allergy of mine. So it will get you to not to get early. You want to make sure that we'll give you the early warning sign, symptom of diabetes, so you can able to watch, and you'll be able to watch. You know what? You can able to really manage. And you manage your health better, and you don't get all these symptoms that will show up. So what is the early sign of diabetes? Excuse me. Okay, early sign and symptom of diabetes, a lot of time is you're going to increase thirst. Wow, I need to drink a lot more water. Your early warning sign and symptom of diabetes is really increased thirst. You also, the skin becomes very dry. And just pre-diabetic, you already have that experience. Your leg become dry, your skin start peeling off, and that is really common for pre-diabetic or diabetes. So net result, all these symptoms you already give you some indication. Wow, you are maybe pre-diabetic or already moving to diabetes. So another thing, blurred vision is another common thing. So people say got diabetic eye, meaning they start getting glaucoma, the vessels in the eye start blocking, all the cholesterol start coming up. Wow, you got to start getting blurred vision. Sorry, excuse me. And then you also get fatigue. You seems like no more energy anymore. And some even have tingling in the hand and feet. And then this is another common sign. Suddenly you start weight loss. And people say, wow, hey, you're looking good. But not necessarily because you weight loss tremendously, like 5 to 10 kg. And also you can feel hungry all the time. Even after eat, you come out, you just can eat more. And also you have numbness. And numbness will be usually at lower extremity, your toe and all those different places. Frequent urination is another common sign. And last but not least, you find sore, which is like an injury or whatever. You have a blister. It doesn't heal. It heals very slowly. All these are warning signs of symptom of diabetes. And this is very common. So if you have some of these signs, what you gotta do? So you need to start, basically looking to a doctor to help you check it out. Because if you don't take some blood tests, you will not know whether you have pre-diabetic or diabetes. You will not know because it's the only way you can tell is through the blood test. Certainly, you do have some sign to lead you to go take this blood test. Like, for example, I'll say, like numbness, frequent urination, unexpected weight loss, and then dry skin. Now, all these signs shows up, is kind of direct you to say, hey, maybe I should see a doctor to find out whether I do have diabetes or pre-diabetic. And both of them need to be start working. Now, one of the very common thing is there are signs also appear in the skin. Now, I will show you some picture. It might be kind of bothery, but you need to know this is the kind of picture you might see. Now, first of all, you got to have basically all these, it's very common on women. You have all these little red spots, okay, in man or woman, and it's can painful and itchy. And if you see all these, red spot, you need to start asking, well, is this red spot? I need to start talking to a doctor to let me know whether I have really a sign of symptom of diabetes on the skins already. Okay, so you need to do that. Now, also you have blister, and this is the kind of blister usually on here, and this blister, basically you have high blood sugar all the time, and it might not, the blister might not hurt. It might not hurt, but you got to check whether you have this kind of blister. And that's kind of also pointing out, hey, maybe I need to see my doctors. Now, also, you have digital sclerosis, meaning your thickening of the skin of your fingers. And could be other body part, meaning that you do have all inflammation, you have high blood sugar, and then spread throughout the body. And this is also can be seen in common. Now, AN is something that is also common, where you have darker skin, the body surface of the neck, armpit, or groin, which is really basically show that you have a lot of insulin resistance, and that's the formula of this. Now, worse that if you start getting diabetic ulcer, meaning that you have area that injured, didn't get well, and an open wound, and that's diabetic foot ulcer. Gotta take care. If you don't take care of this, you can end up losing your feet, because that means that your feet will become gangrene. Now, also that diabetic dermopathy, meaning that you have all these reddish brown scar that will patch up primarily on the leg area, shin area, that, and all could be other part of the body, but more common in this area. Now, these are stuff that if you see that cannot be ignored. You need to go see the doctor to find out exactly what condition you have. So these are the common sign that for a diabetic, which you have this, you better see the doctor. Don't ignore it. So
What is the risk factor of type 2 diabetic? Why people get type 2 diabetic? Well, first of all, most likely if you are pre-diabetic, the chances for you to become a diabetic is very high because you are pre-diabetic already. If you don't do anything, usually it took 2 to 3 years, you are convert to diabetes. Now, suddenly, if you have family history of type 2 diabetic, in other words, my mother is, my father is, your brother is, or sister is, your uncle is, man, that will be a very good chance you can be a diabetes. So with that, you already alerted yourself. You have to, after age 40 years, you better talk to doctor more time and start understanding how to prevent yourself become a diabetes. Now, you also overweight, meaning that you have BMI over like 30 already, and you are you really have no action to lower this weight because you got to get yourself to BMI 23. So that will be good. Now, you also in your lifestyle, a lot of people do. I just sit there and watch TV all the time. I'm a potato couch. Wow, that is easy, very easy for you to become a diabetic. And on top of that, because your age, anything over 45, you have a potential. Because age, your pancreas starts slowing down, everything goes slowing down, you have more chances to become diabetic. And then another one is gestational diabetes. A lot of people have that. During pregnancy, I became a diabetes, but after pregnancy, all the hormonal change, you are getting well. But in 5 years later, you got to watch because you might become a diabetes because without knowing, during that time, especially gestation, your diabetes raised, although you a short time don't have, but later on you become a diabetes. Could be because of your weight, could be your diet, It kind of move yourself into the diabetes scale. So all these are the risk factor you gotta know. So once you're in one of these risk factors, you gotta start doing something. And I'll tell you how to do it. Now, really, at the end of the day, more important, you have start detection, early understanding. And then once I know I'm pre-diabetic and diabetes, I need to take action to work on. So what do I do? So really early detection and with proper intervention is actually decrease all your risks of complication, which is, could be a heart attack, could be kidney disease, all that could be minimized. Okay. And you really have to take action effectively, manage this blood sugar. You cannot just say, well, I'm managing. Well, how? Have you changed your lifestyle and all that? You have not. That is not most likely and effective. So you really have to understand the overall health as a plan. And that's why we have 5 steps for you to do that. And you empower yourself to say, okay, I need to change my lifestyle. I have to have a diet. I have to exercise. I have to change my weight. I have to also, maybe drink Lowsutea. And then I will listen to Dr. Webinar so I understand all the in and out of diabetes so I know how to manage it. Okay. So all that, you empower yourself to do this, and you most likely the risk of getting complication less. Now, certainly with that, you have saved a lot of money on healthcare because now you are no longer have an issue that you have to continue to treat. Imagine you have to every time go to see doctor. You have to all kind of problem arise from leg wound to nerve damage to heart attack. Wow, that would be terrible, right? So you don't want to do that. So really, when you understand now you are type 2 diabetes, you have to reverse the trend, your A1C all the way down to 6.4 and below. That is the key goal you have to do. Remember this, A1C got a 6.4 and below. Now, certainly with that, all that health issue, you are actually impacting the healthcare system, whereby, your doctor fee will go up, you have disease, all that kind of thing. That is not good for the society. So you want to make sure take your part to become a better person to lower your healthcare costs. Now, I talk about that. So what disease that included? And that's the disease that you need to start looking. Because if you're type 2 diabetic, the blood actually going to the brain is stuck with sugars here, the plaques. Remember we talk about? So the plaques are stuck at the end. So the blood cannot reach the brain cell. You know what? you will end up losing memory. And you have dementia. Diabetic dementia is very common, especially old age. You can potentially have stroke. Imagine that you keep asking the same question to your children, saying, "You have eaten dinner yet?" Da, da, da. Every 2-3 minutes, ask the same question. You can't remember. Your short-term memory is gone. On top of that, you might have stroke. Wow, that was so detrimental because you stroke, you can't move a certain part of the body. You can function. That will be terrible for you. And the cost will be extremely high. You can lose consciousness. And the reason, another new type of type 3 diabetic is Alzheimer's disease. Wow, you don't want to get in that too. On top of that, you will be blurry vision, which you have glaucoma, cataract, all that will come along. You don't want to do that. Imagine you're 50 years old and the eyes start getting blurry. I cannot see. You cannot read. Oh, I think that would be very sad. On top of that, you have heart disease where you have a heart attack because your coronary artery is stuck. And when you have that, you are actually will be potential heart attack. You die and you end your game. And you should not really move yourself in that position. So don't get yourself of the heart disease develop. Now imagine 60% of diabetic patients have some form of heart disease. High blood pressure is a common problem. I just have a slight allergy today. And you really don't want to get yourself blood vessels and really you don't want yourself to have blood vessels plugged up. So end up you're going to have a stroke to your brain and clot somewhere. And you don't want to do that. Now, a lot of people don't know that nerve damage because what happened is all the blood flow because of the plaques form, it damaged the nerve cells, nerve ending. So you don't feel. Matter of fact, it's sad. 30% of diabetic patients have no sex function because they can't feel. And if you have injury and you can't feel, so your injuries continue to get worse and it's don't heal because of low fluid blood circulation, you end up with amputation. And the diabetic neuropathy, which means stuck up your kidney, it won't filtrate anymore. You end up with dialysis and kidney function just went down the hill. And I will talk about earlier pregnancy complication because you're gestation diabetic. So all these complications will be there if you don't take care of type 2 diabetic. Imagine that. You don't want to be in this position because with that, you basically increase the healthcare cost. It will be so bad in the sense that your whole lifestyle is gone. All that will come along. So you want to make sure prevent yourself get into this mode. So how do you get prevention? Very simple. Actually, you can do it. Most important is manage your ABC. Lower your 3 high. Lower your 3 high. Remember the 3 high ABC. The first one is A1C. Remember what is A1C? You measure the blood glucose, percentage of blood sugar attached to the hemoglobin. And that's the A1C test. And your goal is 6.4 below. So remember, 6.4 below is your goal. So manage the first A1C. A is your A1C. B, your blood pressure. Your blood pressure have to be 130, lower than 90. Lower than 90. So net result, your blood pressure continue to be good. Now, last but not least, the LDL cholesterol. Your LDL cholesterol has to also come down. So that way, it doesn't mix with the sugar and get your blood become thick and it plaque everywhere. The LDL cholesterol will also continue to go up, will form plaques to heart and kidney. You don't want to do that, okay? You got to get it down. And you will stimulate higher HDL cholesterol, which is a good cholesterol, which helps you move excess cholesterol from the bloodstream and transport to the liver to process. So this A1C and blood pressure and cholesterol, which is your 3 high, if you can manage lower to your normal level, you know what? You will be always healthy. The chances of you get risk to get bad to health is going to substantial decrease. Now, you have to talk about the strategy to prevent of managing diabetic. Other stuff besides managing A, B, C, you have to also quit smoking because smoking causes higher can cause your overall health in the sense you can end lung cancer, insulin resistance, all that will come along. So smoking has to stop so you don't develop further diabetes or higher diabetes case. So overall must stop, and you pollute your lung, and it's going to make your breathing be hard. Don't do that. Very important. You have to have good diet management, meaning you have to go low carb diet, high fiber, whole grain, more fruit, vegetable. And I said, how do you do that? Half a plate are all vegetable. 1/4 of a page is protein with fish, not red meat. It's white fish or salmon. And then 1/4 will be your starch, could be brown rice, red rice, or whole grain. All those will help you to basically to prevent you have more carbs, because every day you can only have 150 to 200 grams of carbs. That's good enough. Plus, every day you have to drink Lowsutea. Lowsutea will lower your 3 high, which is your sugar, cholesterol, and blood pressure. The 3 high every day, every meal, you drink 2 glasses of Lowsutea each meal, you achieve that goal. So strategy preventing or manage diabetic is really something that is you have to take action, regular action. Now, after that, you have to do exercise. And a simple exercise is only walk. You do 8,000 to 10,000 steps per day, and total 150 minutes of exercise per week. You pretty much achieve that. Plus, certainly it would be good to do your barbell exercise this way and step master. That will be extremely helpful. So that will also strengthen muscles and also your gaits of walking, and you should do that. Now, the worst thing, if you are aging, you don't walk anymore. And you know what? If you don't walk anymore, you're not going to be able to walk down the road. So important, a regular exercise, continue to do that. And one thing a lot of people don't know, you have to manage your stress. Because when you stress, the problem is it increase your blood sugar, because the body will say, hey man, you are stressed, you are ready for war. So I will give you more sugar to go out to fight. So that result, you will basically have more sugar to work with. So that result, you don't want to do that, because if you get stress, your cortisol, adrenaline, all this hormone will come out to get you to get more sugar to make sure that you have enough sugar to fight. So stress is definitely increase your sugar. So what you gotta do is you have the good coping mechanism to decrease your stress. Now, certainly you could very simple. You can basically do exercise. You can one thing, yeah, good exercise, good music, meditation, walk, look at green thing is good. But you don't take care of stress. You gotta people is definitely will be able to accommodate the stress is eating a lot more, smoke, get nervous, drink alcohol. All that will affect your sugar. So really, at the end of the day, to manage your stress, it's best to make sure that you take care of yourself by having all these meditation, listen to music, whatever you do, just do that to help you to lower your stress. And today my allergy is bad, so sorry about have to blow my nose all the time here. But anyway, also you need to manage your diabetes with medication, because most likely if you have A1C over 7, the doctor will give you metformin or other medication, and you need to take it. Don't take it. Don't ignore the medication, because medication is important, and this is going to be a long-term medication. It's not going to be 1 or 2 days. You have to continue to take it. So net result of that, taking medication will be very important. Make sure you don't forget, and make sure that you also potentially you have other medication like blood pressure medication will probably come along. So all these medication is to help you prevent complication. So do take a medication. If you're insulin, do take insulin, because that will help you, definitely to help you to lower your blood sugar. That will be very important. Now, certainly drinking Lowsutea definitely help because Lowsutea basically will lower your 3 high. Remember, there's a slide that manage your ABC. Basically, that is the most important. Manage your blood sugar. A1C, blood sugar. And then you're going to manage your blood pressure. B, blood pressure. And then C, the bad cholesterol, which is the LDL cholesterol, lower it down. So all A, B, C, if you can lower that, you are pretty much lower most of the risk of diabetes, complication, and all the problem that you might associate with this complication, like heart disease, eye disease, stroke, brain, dementia, all that will be lower. Now, really, you got to take this seriously. Remember, manage ABC. ABC is very 3 high. Lower it, you will okay. So in conclusion, type 2 diabetes is actually very easy to manage, but it's a serious disease if you don't do it. So you got to really take care of your lifestyle adjustment. Now, really looking for early sign, understand the risk factor, and all the steps to where the onset of diabetic. Like, for example, I start getting black spot on my neck. I start getting dry skin. I start getting itchy, red spot here and there. Now, you got to see the doctor, understand where you at of this, diabetes. So once you start getting this dry skin, numbness of foot, tingling feeling, all that come along, you got to see a doctor to check whether am I have a pre-diabetic or diabetic stage. If you are, you got to take action to prevent them to continue to go up. They will measure A1C. Your A1C has to lower than 6.4 in order to be safe, not 7, 6.4. Now, you have to have all kinds of preventive strategies. Very simple. You have to eat healthy, like lots of vegetable, half plate vegetable, and half quarter plate plate of fish, lean meat, not red meat, and quarter is really all the red rice and brown rice, but not in the sense of a lot of white rice, red rice to help you. And then this way, you most likely will, with healthy eating, weight control, exercise, will lower your type 2 diabetic risk. Now, when you do all that, you really have to continue to commit and manage yourself to have this lifestyle change throughout that, from wherever age you are all the way to 65, 85, 95, you will do the same lifestyle change. When you do that, the chances of you be healthy is very good. You will be have limited risk to get diabetic complications because you no longer diabetic. You move yourself from diabetes to pre-diabetic. Now remember, recognizing the early sign, understand all these actions, how to measure yourself, whether you are pre-diabetic or diabetes, and continue to control that diabetes in that range below 6.4. Even better, you can go under 6. And also all the lifestyle change you have, you know what? You live very, very happy after because the risks of getting really sick are really limited. And on top of that, you'll feel much healthier. You can walk real well. And you can really have a much better health outlook for your life rather than, oh no, I'm diabetes, I'm a problem. You are now a positive, reborn person. And that's why we are here to help you, holding a hand throughout your diabetic journey so you can be healthy and remain healthy throughout your life. And drink Lowsutea basically will help you. This is my end of my lecture. I think you can understand. If you have any question, you can always write to me, Andy, ANDY, at WAHFONG.com. And the WhatsApp number is 852-3001-5644, or you can do 852-679-2891. No, sorry. 852-6792-8891. 852-6792-8891. This is another WhatsApp number I have. But if we're good, you can write to me by email, Andy@wahfong.com. That will be really good. ANDY@WAHFONG.com. So you can do that. That will definitely help you to become better understanding the problem you have, and I can answer the question for you, and that will be really helpful for you. The key here is to empower you to have the knowledge so you can make changes. So if there are no question, I appreciate on your busy Saturday. I'm so glad that Gordon came back and listened to the webinar. I hope you can continue to join us. And we have a lot of new friends here, and many of these friends are actually I'm not familiar, but I know you are listening in. It's really good. I appreciate all your time to listen to our webinar, and thank you again. So if you have any question, write to me, and I hope you have a fantastic weekend. Okay, you take care. Thank you very much again. Thank you. Bye bye.